Okay. So today is July 1st, 2020. My name is Ann Shi. I'm with the Houston Asian American Archive. Here with us today is Johnny Leon, who is a doctor of physical therapy. Thank you very much for joining us, Dr. Leon.
No
Um,
problem.
Thank you. So to start, since it's the first time of your interviewing with us, can you tell us a little bit about yourself?
Okay. Well, as far as I came as a foreign student here to the United States. Actually, I came from Holland. That's where I did my undergraduate work. Then I worked for a little while in England as a physical therapist assistant. And then I came here and also got my degree here. And then finally, in the end, actually, I got my degree at Southwest Texas State University and worked for a while, and then got my doctorate at the University of the Incarnate Word in San Antonio. Yeah.
That's great.
So. Mhm.
Thank you for sharing that. So this is the COVID-19 special collection, and we just want to ask you some specific questions on how your life has been impacted during COVID-19. And as a doctor, you probably have a lot more to share, and we'd really appreciate that. Can you share with us how it impacted your life and your job?
Correct. So this is what happened. Before this, I was mostly in the outpatient clinic, orthopedic outpatients, anything from sports injuries to spinal and all that. And then as this pandemic started happening, you could see a shift. So what I'm doing right now, to explain briefly, is I'm contracting with the CMS, what is called the Center of Medicare and Medicaid Services. In general, a little bit older patients, but not always. And what we do is we're kind of like the forgotten heroes. So you can hear with this whole pandemic, you can hear a lot of the stuff in the hospitals and all that stuff. But what happens to the patients that one that quarantine and after quarantine do not go into facilities, or two, patients who are sick or are disabled in a way, but do not want to be admitted, or their physicians at one time, especially at the height of this pandemic, did not want to admit people into the hospitals unless they were COVID patients. So what we do is, as there are not enough medical doctors available, if you will, uh, we go with either nurse practitioners or doctors of physical therapy. We go to the patients' homes and we evaluate their medical needs and complete a whole medical assessment there in the house. This is, of course, well regulated through the CMS, through Medicare for short, if you will. And so there is quite a bit of official paperwork to be done with that. And then you look at the whole picture of the patient within their home environment, what can be done for them within the home environment, what prevents them from having to go into a facility where the chance of contamination is higher.
Yeah, that's great to hear you're helping out. And also, you spoke about helping patients who are positive of COVID. Can you share some experiences about that?
Correct. So what happens is this. Let's say, for instance, I just had a patient being discharged from MD Anderson, very weakened, very cachectic, very, so deconditioned, if you will. So a patient like this, although they are positive, they still need to be seen. Especially, what we've seen with people who have COVID or are just post-COVID. Let's say people come out from the ventilators, are being discharged home. They have been very deconditioned. Their lung function capacity is less. So, these patients need to do something besides, just trying to get back to their previous level of functioning. And so what you do is you do everything, you address everything from the lung capacity by cardiopulmonary rehabilitation, to strengthening functional, getting the patients back to their previous level. Yeah. So a lot of people don't know that. They think, oh, the patient goes home. Oh, they beat COVID, or they're off the ventilator. But they're usually in very deconditioned state. And it takes a couple of them quite a while to get back. So you need to look at it this way. If somebody comes home, if you see them going out on TV in a wheelchair, that's because they most likely cannot walk. They don't have the strength nor the energy nor the endurance to walk. So you have to start all over again. So that's where the home physical therapy, the home rehabilitation starts. And what you do is you have to strengthen the specific muscles that are needed to go back to function. Because if a person has been laying down in bed, there's a lot of muscle wasting or atrophy that has happened. Yeah.
Yeah, that's great to hear. Thank you. And I was just wondering, how do you protect yourself during this time as you're working so closely with the COVID patients?
Okay. That's why I sent you that one picture of the PPE. Of course, I didn't have my gown on. That was just with my lab coat on. But we have full PPE protection. If a patient is still positive or even suspect of being positive, because right now the tests are not 100% foolproof. So what you need to do is, what they're doing is they test 3 times, and if 3 times two positive or 2 negatives and 1 positive, no matter how you want to look at it, 2-to-1 ratio. There's 2 tests that show either positive or negative. That gets that labels the patient. But you have a lot of we've seen a lot of patients who were suspect of COVID, tested but were negative, but that is still a high risk patient. So you still have to gear up for that. So there's full PPE protection, and a little bit what we can also do is virtual health through through online stuff, although that is a little bit limited, but we can do that too. We have done that.
I see. Thank you very much. And just wondering, how has the COVID-19 pandemic, as many of the rest of us are staying home, how has the kind of stay-home order impacted you personally?
Not that much, right? Because we're in the healthcare profession, so especially now. So what was happening in the outpatient clinic, we were getting we were slowing down because that is more elective. People can choose to come or not. The sports injury, will heal by itself over time. So the acuity of an outpatient clinic is less. So personally, what I did is, as I saw that coming to a halt, basically, I switched mode towards one that has been busy, which is the home health care for patients who do not want to be admitted into hospitals, or who come out of the hospitals after having won the battle with COVID. So personally, it slowed down maybe a little bit in the beginning, but once I made the switch, yeah, it's busy, and right now it's definitely ramping up. A lot of more people see the value of home-based therapies and treatments, because think about it this way: when you're in the home and the one healthcare profession comes to visit you, you only deal with one person. You're going to be in a facility on the floor. There might be 50, 100 beds on the floor. There's always a little bit, there's staff walking around. There's more chance of contamination. So home health has been a lot of the time a more safe alternative than being in a facility. Yeah.
Thank you for sharing. And we're just also wondering if you have been taking precautions to protect your family, given you're also in contact with the COVID patients.
For sure. So one thing of this is this whole thing is, you cannot be scared of it. You need to be informed. You need to be educated on it. And we find a few new things out, but pretty much we know how the contamination happens right now. There's not too much new stuff out. There is some new stuff out in signs and symptoms that sometimes come back, or some new stuff, sneezing now, a little bit diarrhea, although that was from the beginning. So what I've done from the beginning is everything stays outside. So the decontamination, if you will, and I'm not the only one. People who definitely work in healthcare facilities, you know, they have to do this even more. So when you come home, you decontaminate everything from the shoes. You know, I use the techniques that are being used in surgical centers. You clean the soles of your shoes, you leave them outside. You disrobe those, you leave them outside. In the sun is best, really. That is your free ultraviolet treatment. Uh, and then once you come in, as soon as you come in, the first sink or bathroom that is assigned the decontamination room. So you clean up there, and everything stays outside, bags, everything. Yeah, and that's how you keep things separate. Before you even get into the house, you're already clean. Some people use their garages, which is a good thing. You come into the garage, they have a shower booth there, and that's where they leave it.
It's great to hear you're taking so much precautions. And I'm just wondering, as a healthcare worker who are probably experiencing a lot more pressure than before, have you experienced any anxiety or depression during this period?
No depression, right? Because we all have a little psychological background. We've studied it enough. So anxiety, probably not. Basically, one thing I can say is everything takes twice as long. So whether because of the whole gearing up when you arrive at somebody's home, before you do you prep up, it takes twice as long. A visit that used to be an hour at the most is now 2 hours easily. So everything is slower. Everything takes more time. And actually, it's the same thing for the civilians, because basically, if you go to the store and if you're in your car and you clean your hands and you put on the, you know, your gloves and your mask, you're not just jumping in and out of the car to go into the store, right? So of course we know a little bit more. We know sterile techniques, so that's why we take it one step further, um, because there's also certain amount of liability involved with that, you know. If, like for instance, we have to send in our vital signs every morning before we even see any patients. Yeah. So no anxiety and depression here. Anxiety maybe in a form that yeah, you have to go with the flow. So it's not fun. It's just sometimes it's a pain, it's a hassle. But what can you do, right? You gotta continue. Mm.
The following question might be a little bit tricky, I guess. Since the start of the pandemic, especially early on, there's finger pointing and calling names and the xenophobic attacks on Asian American community, and also even on like Asian American nurses and healthcare workers. They experience the kind of treatment from their patients as well. I'm just wondering if you personally experienced something like that, or have you do you have any thoughts you want to share regarding that?
That's interesting. That's almost a little bit more political than it is real life. I have not experienced that. I've not seen a patient flinch when I show up and they kind of over your mask see that you kind of have Asian eyes. Now, I'll tell you why I personally think this is a little bit overrated, and that's why I haven't seen it maybe. But in general, in the healthcare profession, there have been always a lot of Asians, a lot. Whether it's the Philippine nurses, whether it's the Chinese researchers at MD Anderson, whether it's many Asian, whatever Asian background they are, Korean, you know, ABC. There's been always a lot of them in the healthcare field. So I feel that the public, the patient, the public has become very familiar with an Asian healthcare provider. And as a matter of fact, Asian healthcare providers in general, in my humble opinion, we excel in giving care. Uh, for instance, let me just call. For instance, the Filipino nurses are 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 very known for their compassion, towards the patients. Patients have picked up on that over the years. So we have established a good reputation with the patient population. Because of that, I have not seen or heard from my colleagues any uh, anti-Asian sentiment within our field. Now, if you look at the things that happened somewhere in West Texas, where some Cambodian family was attacked, that person I think that attacked them was, if I read it correctly, was I think Hispanic. The name was sounded Hispanic, but I'm not sure. So anyway, it seemed like it was somebody who went over the edge, deranged, definitely some kind of mental disturbance, if you will. I think those are rare. I haven't heard anything here in Houston though. What I have heard of in Houston is people robbing uh, the Asian consumers in Chinatown. That I've heard more of. And that's because I have a lot of friends who are in the restaurant business. They have shop stores in Chinatown. So that I've heard of more. So those are crimes of opportunity. People are getting desperate with these times. Everybody's hurting, but some people feel that they need to go robbing and stealing and mugging people. So I've heard that on personal level. On personal level, I've heard many stories that people are shopping at H Mart or at Welcome Supermarket, and then they're being robbed. People drive by, steal a bag from their car, their purse, or even while they're sitting in the car, they get mugged inside the car, stolen, the purse stolen. That I've heard, yeah, but not like not an anti Asian sentiment.
Yeah, that's good to hear. You haven't, yeah, those are definitely the kind of negative side of the pandemic we're in from the human beings, I guess.
So this is the thing, right? Have you experienced any of it yourself?
No, I have not. I actually have been in all like 3 months. So very little interaction with humans, actually.
Okay, okay. It's an interesting thing because I know that they had a town hall meeting. I think Gene Wu and all that, they had some town hall meeting, virtual town hall meeting, and my friends, I told them, listen, maybe there's something in it for you. These are businessmen, these are restaurant owners. So I told them, why don't you listen in on this thing, because I'll be busy working around that time, but maybe there's something, and maybe they are lending assistance. But it was mostly on anti-Asian sentiment. And frankly speaking, from the field, these people, my friends or my acquaintances, they told me, well, when we heard what it was all about, that was not what while we that was not what we were expecting from a town hall meeting. We were expecting things like the Asian businesses have been hurt hard. What can be done to point them into the right direction, to go and get some financial aid, economic assistance, to prevent their businesses from going down. That's what people were interested in. Remember, Chinatown was hit hardest early on when the news came in from what was it? From people who had come out of Egypt or something like that. They'd been on a trip, right? And then they had gone to one of the stores and had contaminated the fresh produce market. That's when people stopped going to Chinatown. And I must say, Asian people themselves.
Yeah, there's definitely things that we need to distinguish between political and, yeah,
Correct,
like
correct. This is a pandemic. It has hit. If you ask any of if you walk into Chinatown right now and you go into a store or a restaurant and you ask anybody, how can we help? What do you need? It's not gonna be on there. The first reaction is not gonna be like, oh, we need protection against anti-Asian sentiment. What they'll tell you is, show me the direction, because we Asians are usually not used to asking for economic assistance. this is the problem I think I see with the people I know in the industry. They have a hard time asking for that. So most of them have gone back on their reserves, but nonetheless, they're hurting bad. You know, the businesses are hurting. Uh, so, but they are not getting the assistance, which is economic, small business loans, you know, that there's usually, and I think this has to do with the Asian community in general being a little bit isolated. They're a little bit isolated as far as they're self-sufficient, you know, uh, they're self-sufficient. So that has made them over the years a little bit more isolated. And I'm not sure if their representatives that have been elected are actually, you know, trying to assist with that, you know, rather than go into this whole thing about, oh, anti-Asian sentiment.
Yeah, we definitely see a lot happen during this period, including the social movement we're in right now. Yeah, Rice University's the William Marshall Rice statue has actually recently been taken down.
Oh, they took it down?
Yeah, yeah. So
Oh, wow. Wow. Well, I have my own thoughts on that, you know. Where are you from? Are you from Taiwan?
oh no, I'm from China mainland,
Mainland. What province?
Guangzhou.
Guangzhou. So you speak Cantonese.
Yeah.
Ah, I see. Okay. Okay. So that is the other part of it, but most of uh, my martial arts background, my sifus are in Hong Kong and Guangdong origin. So that's what we're from. But I'm Hakka. I'm Kerja. Yeah, Hakka. So anyways, but we went to South America a long time ago. But that's another story, right? That's another interview, I guess. So yeah, it's tough, man, because I know a good friend of mine from college. His father graduated from Rice University, and so did his nieces. You know, the family's tied into to Rice University, and I don't think they necessarily agree with it because it's part of history. You cannot change history. You can learn from history, but you cannot change history. Um, it would be the same thing um, as if the CCP, and I don't want to be I don't want to be political, but if the CCP would have said, "Hey, there was never an emperor in China. The imperial stuff never happened." You know, you cannot erase the history like that. So you can learn from it. That, for instance, in this example, CCP said like the imperial court, they were selfish. They took most of the monies. You know, the population was poor, starving, and all that stuff. So that was learned, but you cannot say there was no imperial court. But that's just my personal opinion. I like history. So I study history for what it is, and any history in the world, and then you can learn from it, but you cannot erase it.
Yeah, definitely. I think in the Cultural Revolution they did somehow like erase.
Correct, correct. Which was wrong because what happened now, all the all the all the artifacts and the historical artifacts and all the treasures, fortunately, Kuomintang took it to Taiwan. Otherwise, it would have been destroyed. See? So that is how history works. You know, why destroy all your books, you know, that was not good. Cultural Revolution was not good, I think. You know, but yeah, same thing here. They can learn, they can change for sure, but you cannot erase history because then, if you think about it philosophically, if you erase the history, then you erase yourself as a nation, right? So if you say like, oh, um, uh, let's say, you know, the imperial court never existed. Well, then the revolution in 1911 never existed either, right? Because there was no imperial court to overthrow. Something like that. Mm.
Yeah, we'd definitely love to discuss more in our full oral history interview. Um,
Sure, sure.
and to carry on with our discussion on COVID-19, like
Mhm.
we're seeing so many things happening online these days, including town hall you mentioned, it's on Zoom, and you're also taking patients on virtual settings. Like, how do you see this kind of virtual culture has becoming more predominant, and are you kind of optimistic or pessimistic on this?
That's a difficult question. Uh, it's efficient, maybe, because what you see now is one person behind a computer can see multiple patients. One done, the other one, right? Even if they're not even in the state, they can be anywhere. So that is kind of effective. I don't know if you know, but we can listen to the lungs right now through the computer. So we plug in a USB stethoscope. Somebody, the family or an assistant is at the home, and they're just putting wherever we want to listen to, and we can listen to the auscultation of the lungs. So that's kind of interesting too. How I don't know, but is it more or less accurate? So, but virtual has changed in as far as making things more maybe efficient. Certain things that can be done virtually we never did before, and now we can do it. Right? There's no reason why you cannot do an assessment, a medical history taking over the computer. You can do that. You can. I can do pretty much almost all of my assessment by virtual, even if it means movement of the patient. I can just ask the patient move like this in front of the camera, and I can take my measurements from that. I can do certain timings of how fast they move and all that. But there's a few things that you probably cannot do virtually. So if that's the case, then I still opt to go in. If there is certain things in the exam that I still need to be, even if it takes maybe 15 minutes to complete, then I'll still go in to do that. But um, yeah, the virtual stuff, the, the the bad part of the virtual stuff is it's still two-dimensional, and I've seen this a lot with old people. Old people, when they talk to you in person, no problem. When you have to do a virtual with them because they got sick or they got pneumonia, um, they get confused by they're not as savvy as the young people, so they can't hear too well. They're like they stumble more in their interview. So it's not so efficient that way. So you can see the old people, they can't deal too much with that. Yeah, we give patients an option. Do you want to be virtual health, or do you want to have in person? And most 99% opt for person. It's an interesting thing, right? Because it's still human. It's like this Chinese medicine. You know, if I would take, I can't take your pulse over the virtual. I can look maybe at the tongue, but the lighting is off. So so it's difficult. Certain things you have to see in person. You cannot. I think one thing you cannot gauge 100% the emotion. That's you're talking about depression. Depression is very real now. Anxiety and depression very real. So uh, when you see a person in two dimension, or you can't see eyes, or you cannot see the 100% reaction because there is a distortion or a delayed voice transferring, then you don't get a good feel sometimes of it.
Yeah, I'm sure most people will be missing that human interaction after we come out. And also, just wondering, you've been seeing mostly, you said, patients with Medicare. And have you come across patients who don't have medical insurance and are struggling?
So CMS stands for Centers for Medicare and Medicaid. So Medicaid is the no, well, they do have insurance actually, but Medicaid is in general for the poor population. People who don't have enough money, and also they go on Medicaid. I see mostly Medicare, so the elderly. I've not seen too many, you know, very, very poor or Medicaid patients. So most of our mix is either private, as a commercial insurance, or private insurance, or Medicare because they're past 65 years old. Yeah. But I have not seen too much of the indigent or the Medicaid population, although they fall under the same branch. Yeah.
Yeah, I guess just one last question before I let you go. So, do you see this pandemic has revealed some more severe aspects of the social inequality? For example, we're seeing the people who are in poverty being more impacted, and the homeless who have no, like resource or access to healthcare, and yeah, things like that.
Okay, so that was existent before the pandemic. So how it works is, let me give you a quick thing. So people who are poor, you know, have no insurance, usually they have still have access to community health centers. But since those centers are they they are well enough funded, but usually they see uh, you know, they might be under capacity as far as there's fewer centers than, let's say, commercial clinics over the city. So in general, those clinics are pretty busy. People come and, you know, and they get seen, but you cannot make an appointment. It's basically waiting and in line and all that. Um, so that was existing already. Now, if you're talking about healthcare and poverty, it's always obvious that the ones that are not so poor always usually have better insurance, especially in the United States. There is no national healthcare like in Europe. Everybody gets to be seen equally. But what they don't tell you is in Europe, that may be also long waiting lists. So so here in the United States, as the character of the country and the nation, people have opted for, hey, if I work harder, if I make more money, then I can you're gonna I can afford better insurance, and if I can afford better insurance, I should be able to be, you know, to be seen more uh, faster, you know, being faster accepted into a facility, or get an appointment. So it's a different system. You cannot compare it to Europe or Canada, where there's national health. Um, yeah. So in general, it's like anything else, right? More education becomes less poverty, becomes better health. Look at Rice University. You see, so Rice University, it's a uh, definitely the clientele or the student body is definitely well educated. It's also more middle and upper middle class. Um, and so with that healthy lifestyle, you know, it's being comes in part of your studies is understanding healthy lifestyle, wellness. Those concepts are usually more of a luxury if you compare it to the poor population. So concepts of wellness, prevention, taking vitamins, to, you know, all that stuff. That you will see that probably less in, well, you will definitely see it less in a poor population. So the health that way will always be staggered in favor of the ones that are more educated and have a higher level of income. Yeah.
Thank you, Dr. Leon, for answering all my questions. Is there anything else you would like to share with us?
No, it was an interesting interview. Yeah.
Well,
So
yeah, helpful for me to understand more about healthcare workers on the front line. We really appreciate your effort in keeping the people in need in shape.
Yeah, let me say something about that. This is an interesting thing. So, for us healthcare workers, we chose a profession, whatever that may be. Uh, it's our job, it's our work. So, we appreciate the appreciation, but it's still our job, our work, right? So, sometimes, you go in, it's like, okay, I need to be careful now because, my older mother is at home, so I don't want to get her infected. There's risks. So it's all about taking calculated risk due to knowing the mitigating factors, the safety factors. And one thing that has become a little bit, and I appreciate it, but personally, I don't look at it that way. Uh, Maybe it's a little bit political, but people are like, oh, we need to pay the healthcare workers more because they're taking more risks. Uh, People need to realize that healthcare workers are the only ones that have had too much work in this time and during these times. So if you're looking at in general staff in the hospital, they are doing overtime, overwork granted, but also being overtime paid. So there's also, time 1.5. So as first line providers, they're just doing their job. For them, they chose the profession. So that's what they do. um, do they need more financial aid? I don't think so, to be honest. Although I would welcome it, but I don't think so because they have had work. There are other segments in society, as far as professional professions and industry in the industry that actually have been hurt much more, much worse, right? So people who don't have a job, the hospitality industry, people who've been laid off just like that overnight, no income. Um, those people have been hurt harder. The healthcare profession in general has had steady jobs and actually more of it than before, if you will. So yeah, when people's like, oh, we need to pay them a little bit more for risk, that becomes political, you see. But it's not looking at the real thing. The real life is help those that are hit the hardest, and we are doing okay. We appreciate the free food and also those tokens of appreciation. We do that, but at the same time, we're not asking ourselves for more money. That can go to other people who need it more.
Well, that's great to hear, and really, yeah, we really appreciate your very thoughtful kindness as well to help other people who are in need.